Hi, I'm David. Today we're going to do a hip and groin examination. This is Steph. He's kindly volunteered to be our patient. So first of all, it's important to adequately expose the patient. And to do a good hip and groin examination, it's important to examine the back as well, because we can get lots of conditions causing radicular pain to the hip that can present as hip pain. So things like sacroiliac joint disorders, discitis, degeneracies. So if we have a look at your back to the minute, so if you turn around, Steph, this camera. So we're looking for any kyphosis, any wasting or hypertrophy of the muscles there. That's fine. Okay, and if you turn to your side as well, so if you just place like that. From the side, we're looking for any for the normal lumbar lordosis, thoracic kyphosis, and cervical lordosis, and that seems to be normal. Good. Okay. And if you turn towards the wall here as well. So first of all, we'll just start by palpating the back and tell me if you've got any pain at all.
No pain.
No pain. Good. Any pain here?
Nope.
Great. Okay. And we'll just go through a few movements as well. So ideally we test this with the patient sitting down, so we can the hips can stabilise the back, but we'll just continue this with the patient standing up. So if you just keep your legs straight and just bend over like that for me. Good, okay. And then come backwards and bend backwards. Good, okay. And keep your legs straight again and just slide your arms down your legs like that. Good, okay. And come back here and just turn around like that. Good. So there we've tested flexion, extension, lateral rotation and lateral flexion, and they all seem to be normal. At this point as well, I think we'll do a stroke test to assess the sacroiliac joints. So Steph, if you just stand on one leg for me. Okay, I'm just going to take your hips here, the posterior superior leg spine. Okay, and just arch backwards. Okay. Do you have any pain at all in your buttocks?
Okay.
Okay, that's fine. You can put your foot back on the floor. So pain on the standing leg could be a sign of sacroiliac joint disorder. That's great. All right, so if you can turn around now and have a seat on the table. So continue this back examination, and if you lie flat as well. Okay. So we continue the back examination by just quickly assessing the neurovascular status of the lower limb. So can you feel all this stuff?
Yeah.
That's all fine. Good. Okay. And can you move your ankle up to the ceiling for me, just like that? Good. Okay. And downwards. Push your foot downwards. Good. And same thing again. Move your ankle up like that and downwards. Good. Okay. And we'll just check the pulses as well. Good, that's all fine. Okay, now we're going to check stretching the sciatic nerve. So if you keep your legs straight up, I just want you to lift it up for me. Keep going, keep going. Good, okay. And any pain at all?
Nope, no pain.
Okay, good. So I have pain going from buttocks down below the knee and into the foot. That could be caused by impingement of the sciatic nerve or disc disease. That's great. Okay, so after all that, we can move on to examine the hip and the groin. Ideally we'd expose the patient to more just to have a good look at the hip, but we won't do in this case. So we'd be looking for any bruising, erythema, swelling in the groin. And after that we can move on to the palpation part of the examination. So we'll start off with the ACIS, so just palpating here. Any pain here at all?
No.
Okay, so this is the incision point of the sartorius muscle. So we're looking for any signs of tendinopathy here, and then we go down to the anterior inferior iliac spine, and that's the attachment site of the rectus. Any tendons there?
No.
Good, it's okay. After that we can palpate medially, so we go down here, assessing the pubic tubercle. Any tendons there at all?
No.
Good, and centrally the pubic symphysis. No tendons there. Okay, so tendons there could suggest a fracture or osteitis pubis. After that, we can assess the medial aspect of the groin. So if you just flop your knee out just to the side there, just like that, okay. I'm just going to be feeling medially here, so we're feeling the brachialis muscle and the adductors. Any tenderness at all?
No.
Okay, good. And can you feel that?
Yeah.
Okay, so we're checking for sensation of the obturator nerve there. reduced sensation could mean impingement of the operator nerve. You can bring your leg back like that. After that, we can feel laterally any tenderness at all.
No.
Okay. Then feel over the greater trochanter. Any tenderness there?
No.
Good. Okay. Tenderness there could mean bursitis. It's also the attachment point of the gluteus muscle. That's fine. Okay. Right. After that, I'm going to assess the lateral aspects of the hip and groin. So if you don't mind just lying on your side, just to face the wall there. That's okay. So any tenderness here again?
No.
Good. Okay. And now we can feel over the iliac crest. Nothing there?
No.
Good. After that, we go down to assess any tenderness of the ischial tuberosity. So we have a feel here. Any pain there at all?
No.
Good. Okay. So that's the incision points of the hamstrings. Tenderness there would raise the possibility of tendinopathy. We also assess the sensation down here. Can you feel all that?
Yeah.
Good. So numbness there could suggest impingement of the sciatic nerve. That's good. Okay. If you come back and lie on your front, lie on your back again. Okay. So after the palpation, we can move on to movement. So what I'd like you to do is just to bend your knee as far up as you can to your chest. That's for assessing flexion of the hip. That's good. Okay, and straighten it out again. I want you to bring this foot towards me now. Good. Assessing abduction. Yeah, good. Okay, and that's fine. Bring it back. And just cross your legs now. So with your right foot, just bring it over your left leg like that. And assessing adduction, go as far as you can. That's good. Okay. Excellent. Now if you bend your knee again. Okay, and keep it like that. Okay, and move your foot towards me. Good, and that way. Okay. So moving internal and external rotation here. So we'll do the same movements again, and I'll just take you through the same movements, okay? So we've got good range of reflection and extension there. So give it abduction, good, and adduction, that's good. We'll now go internal and external rotation. So external rotation, that's good. And internal rotation. Any pain on those movements?
No.
That's okay, so that's good. So we'll do the same thing again, but I want to assess your power of the muscles when we do that. So if you bring your leg up like that, okay, and stop me from pressing it down. Good, okay. And straighten your leg out now, just onto the table. I'll push my hand down into the table. Good, so we're assessing extension here. And squeeze my fist with your legs. Good, so assessing adduction. And push my hands upwards like that. Good, assessing abduction there. If we bring your leg back as well into here, so push your foot against my hand there, excellent, and against my hand on this side as well, good. Okay, so there's good power through all of the range of movements there. Excellent. So after that, we can go on to assess if there's any tightness of the hamstrings. So let me just take the weight of your legs there, and just try and relax. Okay, I'm just going to extend your leg up. Okay, we seem to hit an end point roughly about 100 degrees, 110 degrees, which is a bit less than normal, but it's nothing to worry about. We can also assess for contracture of the hip as well. So if you bring both knees into your chest like that, just okay, good, and put your arms over your knees just to keep them in, okay, and keep both arms on your left knee, good. I'm going to bring this right one down, okay, all the way down, good. So there's good extension there, there's obviously no flexion contractures. That's great, okay. After that we can go on to a few specialist tests. So we've done the stalk test and the straight leg raise test. Another test for sacroiliac joint disorders is the lateral compressibility test. So if you don't mind just facing the wall again, Steph. Thank you. I'm just going to press down on the hips here and tell me if you've got any pain.
No.
Good. Okay. Someone with a sacroiliac joint disorder
will have pain in the sacroiliac area. So okay, if you come back as well. Another common presentation is piriformis syndrome, so we can check for that by asking the patient to externally rotate against resistance. So if you bring your leg again up like that, Steph, good, and push my hand inwards like that, excellent. Any pain in the buttocks when you do that?
No.
That's good. Okay, that's great, thank you very much. So to end my examination, I also examine the left hip and groin. I do a full neurovascular examination as well.